Hello friends, one of my most watched playlists is on PCOS and I keep on getting questions related to PCOS, which makes me believe that there are so many girls and ladies outside who are suffering from this condition and they are quite confused and bewildered with the symptoms and lack of solution that they are facing. Here in this video, I shall try to answer few of the commonly asked questions by these ladies. Why does my period get irregular when I stop OC pills? It is important to understand that a lady would have a regular period only if she is ovulating regularly every month. In polycystic ovarian disease, the ovulation is not happening or it is happening irregularly. When you take oral contraceptive pill, it doesn't make you ovulate, but what it does is it creates an artificial situation in your body where the estrogen and progesterones are present in a manner provided from the pill that it mimics a normal period cycle, and we stop the OC pill at the end of 28 days. We find that the periods have started. When you stop taking oral contraceptive pills, your body is not ovulating by itself and there is no oral contraceptive pills as well. So there is no progesterone to get you the withdrawal bleeding, and that is why you have irregular periods till you again have a period after maybe 3, 4 or 5 months. Is myoinositol effective in controlling PCOD? Myoinositol is a plant-derived product which has got some role in regularizing the insulin metabolism. Having said that, there is not enough evidence scientifically to suggest that exclusive use of myoinositol will regulate your PCOD related symptoms and the hormone disbalance. Though there is no harm in using myoinositol, for how long will I need to take oral contraceptive pill? Now, unfortunately, there is no definitive answer to this particular question. There are few ladies who would use their lifestyle to such an extent that they are able to control their PCOD by losing weight, by exercising, by controlling their stress, etc. But there are those who, despite doing all this, in their case the PCOD doesn't come in control without the use of oral contraceptive pills. Oral contraceptive pills increase the level of sex hormone binding globulin levels in your body, to which binds the testosterone or the androgen in the body, which is present in excess in the ladies who have got PCOD. So now, as long as you are taking the oral contraceptive pill, there is increased SHBG level in the body, which will slowly decrease as you leave the oral contraceptive pill, and then you will notice that all those androgenic signs symptoms like increased body facial hair fall, irregular period and everything has come back. So it will totally depend upon your genetics, your effort, how much effort you have put in maintaining your good lifestyle and eating healthy. So but for the timing, I would say at least for a couple of years you need to take it, and after that you can leave and see whether after leaving it you get your periods regular, your symptoms are in control or not. If they are not, unfortunately you will have to take it for longer period of time. You have to understand, just like somebody has got diabetes or raised blood pressure or any other chronic condition, they have to take medication for the rest of their life to keep it controlled. Though their quality of life is same as that of anybody else, but at the same time they need to take the medicine. Just like in your case also, oral contraceptive pill is something which is a long treatment which you will have to take if you have to ensure that your PCOD symptoms are under control. Is there any natural way of controlling PCOS or PCOD? Definitely it is. Majority of the effort that can come from you is all natural, which means that you should sleep 6 to 8 hours in night. You should try to minimize your stress level, do pranayams, eat a mindful diet, which is a balanced diet which has got adequate amount of protein, complex carbohydrate, good quality fat, and avoid simple carbohydrate, avoid processed food and avoid trans fats and bad fats. Ensure that you are drinking lots of water, and everything, as you can see, is natural. You can add on things like myoinositol or cinnamon, or you can add seeds, etc. That is all fine because they're not harming you. But don't just rely on these adjuvants. They are just adjuvants. Main thing is how you modify your lifestyle for a healthy living, and which should be like throughout your life. You have to make it a routine. It has to be a way of your living. You cannot do it for like 2 months, you do all this and then you leave it for 4 months and then you expect the PCOD to be under control. It won't be. Will seed cycling help me? Well, this is a naturopathic concept, and as a allopathic doctor, I am not the right person to answer it. But as far as allopathy is concerned, taking seeds of various type, that is healthy, but it won't make any difference if you take 2 types of seed in the first half and 2 types of seed in the second half of the cycle. That is not going to regularize the estrogen and progesterone. Seeds in themselves are healthy. You should eat it. Everyone should eat it. But it's not as if, please don't have unrealistic expectation that that is going to control all your PCOD symptoms. They won't. What can I do for my facial hair which I have got because of PCOS? If you do not wish to take any medication, then you can go for epilation, you can go for waxing, you can go for laser therapy, you can go even for shaving. But if you think that this is not what you want, then oral contraceptive pills and other medication which increase the sex hormone binding globulin in your body or has got a estrogenic effect, which opposes the androgenic effect in your body, that is what will help you in losing the facial hair. And it is something, these oral contraceptive pills you need to take for a prolonged period of time before you can actually see the effect. There is another cream which is available in the market with the name Venica, and that also can be applied. So it is not like wheat or something which applies the hair, but it is something which slows down the growth of the hair follicle, and that is something which you can try. If you lose your fat by even 5%, that will also help in correcting other symptoms of PCOD as well as decreasing your body and facial hair. What should I do to lose weight in PCOS? The principle of weight loss is same whether it is in PCOS or in routine life. We have to eat a well-balanced healthy diet which is rich in complex carbohydrate, healthy fats and adequate amount of protein. At the same time, we have to ensure that if we are already overweight, then we have to eat in calorie deficit. And how to eat in calorie deficit, I have made a separate video for it. Please watch it. Exercise, and if your calorie intake is less than your output, then definitely you are going to lose weight. But if in case you eat the same amount of calories as you were eating before, you're not going to lose the weight. So it simply means that you have to work more, burn more calories than what you are consuming in. And if you do that, even if you have got PCOS, you will definitely lose weight. The pace of it might be slower than somebody who doesn't have PCOS because they don't have insulin resistance. You have to fight that extra enemy, but still you will lose weight, that is for sure, and that is guaranteed. Is Ayurveda helpful in PCOS? Well, I'm not Ayurvedic doctor, so I cannot comment whether Ayurveda is appropriate for PCOS treatment or not. PCOS is a relatively new disease which came in 1935. That is when it was diagnosed by Steen and Levinson. There can be medicines which might be helpful in PCOS, which an Ayurvedic doctor will be in a better position to comment or help you out. Please seek help from them, and I'm sure they will be more than happy to help you out. What is the difference between PCOS and PCOD? PCOD is when you get an ultrasound scan and it has an appearance which is very typical of the polycystic ovarian disease, but at the same time there are no other symptoms like irregular period or increased body facial hair, etc., which is present in case of polycystic ovarian syndrome or PCOS. In PCOS, apart from the ultrasound findings suggesting of polycystic ovary, there are other symptoms which is irregular period, increased body facial hair, hair fall, a tendency to have abdominal fat, which is the male pattern of obesity, and all this combined together is called PCOS. There can be, deranged blood sugar levels, raised cholesterol. So there are so many other things which are in PCOS, and PCOD is just the ovarian feature that you see in the ultrasound scan. If I don't wish to take oral contraceptive pills, How will I get my periods in PCOS? First of all, it is important for you to get your periods at regular interval. That is so because when you are not ovulating and your inner lining of the womb, which is endometrium, it gets thick, and it has been happening for several years, it puts you at increased risk of endometrial cancer, which is the cancer of the inner lining of the uterus. To prevent yourself from that, you need to either have your periods regularly by taking hormonal pills, or you need to use some device like Mirena, which makes the inner lining of the uterus thin, or take the oral contraceptive pills for like 3 months together, so that for 3 months the inner lining of the uterus is thin, and then in 4th month you get your period, which would mean that you are minimizing the total periods to 4 periods in a year, but at the same time the inner lining of the uterus is not getting thick because you are taking the oral contraceptive pill to keep it thinned out. But if you wish to minimize the level of hormones in your body but still wish to get your period, you can take progesterone, which comes in various tablets, Primolute, Modus, and there are so many others which can be taken like at 1.5-2 months interval. If you have missed your period for 1.5-2 months, take the tablet for 3 days, and then when you stop it, you will get a withdrawal bleeding, and that way you can minimize the amount of hormone in your body, still get the period. But mind it, this way you are not going to get other benefits of oral contraceptive pills like decreasing the facial hair, acne, etc. I hope that you found this video useful and you got answers to few of your frequently asked questions. If in case you still have any questions, please do comment down below and I will be more than happy to answer you back. Till we meet next time, have a great week ahead. Till then, bye bye.